Christine with the Women's Clinic, and we're going to talk about STDs, also known as sexually transmitted diseases today. So what is and what isn't a sexually transmitted disease? STD is basically a disease or an infection acquired by sexual contact. That can be any kind of sexual contact, whether it's vaginal intercourse, anal, oral, technically, possibly certain types of heavy petting, you could get a sexually transmitted disease as well. So what isn't? Things like bacterial vaginosis. While it may be aggravated by intercourse, the bacteria that cause bacterial vaginosis is natural to the vagina in low amounts, and what happens, it just gets out of balance, and sometimes intercourse and or certain partners might make you at higher risk for having that occur. So that's not technically an STD. So how are STDs transmitted? They're passed person to person in blood, semen, vaginal, and other body fluids, and by skin-to-skin contact. Different causes: bacterial, parasites, and viruses. So of the bacterial, chlamydia is the most common, and it is a reportable condition. We saw a 4.7% increase across the country of reported chlamydia cases from 2015 to 2016. Obviously, since we're just now into 2018, they don't have the current data yet up on the CDC website for 2017. Second, gonorrhea, we saw an 18.5% increase, and syphilis, we saw a 17.6% increase. Scary thing about syphilis is that if you get it while you're pregnant, it does cross the placenta and can affect your baby with both birth defects, and they will be born with congenital syphilis. And that's we saw a rise of 27.6% last year, or in 2016. So, while syphilis had about a decade ago been almost completely eliminated, we are starting now to see a rise in syphilis again across the country. Chancroid is another bacterial STD. It's not very common. It's caused by the bacteria Haemophilus ducreyi, and it's often not tested for. So if someone's traditional tests come back negative, but they continue to have problems, that may be something that physicians need to think about. As far as parasitic STDs, the major one is trichomonas. It's pretty much the only one in this country. And then for viruses, HPV, which is the human papillomavirus. It's a family of wart viruses. There are known to be at least 40 different DNA subtypes that prefer to infect the female and male urogenital system. We've got herpes, HIV, hepatitis B, and hepatitis C, all which can be transmitted through sexual activity. So what are the symptoms? This is where it starts getting scary. The vast majority of people may have no symptoms whatsoever. And in fact, for chlamydia, 70% of women are asymptomatic and 50% of men are asymptomatic. And it is the most common STD reported in the last couple of years. You may have a rash. That's commonly seen with like syphilis. Pain with sex or upon urination, it'd be like a burning, irritated pain, both for men and women. That's a possibility. Abnormal vaginal or penile discharge. And then if you have like skin changes, sores, bumps, blisters, or skin irritation that's persistent, and even if it goes away on its own, because that's what herpes is. It basically causes a short-term blister that will clear up, especially if it's a recurrence, and then it'll be gone. And a lot of people say, oh, it must have just been an ingrown hair, and they don't even realize that that's what it was. So where does Texas rank out of the whole 50 states for some of these? Well, with chlamydia, it ranks number 15 out of 50. For gonorrhea, we're number 17 out of 50 states, and for syphilis, we're number 19 out of 50 states. So, you know, we're in the upper half, and actually we do see an increase in all STDs more in the south than in the north. So what are the consequences of getting an STD besides feeling that maybe you're less than a great person, which is a really common misconception? There are plenty of people who get STDs who never thought that they would, and it does not mean that you are a bad person or a nasty person. It just means that maybe you got unlucky and made a poor choice at some point. So, gonorrhea and chlamydia can lead to pelvic inflammatory disease, where the infection goes from being in the cervix into the uterine cavity into the fallopian tubes, and sometimes it can cause abscesses at the ends of the tubes and around the ovaries. And once we get to that point, infertility is a really high likelihood, and if we end up with scarring in fallopian tubes where someone can actually even still get pregnant, an ectopic pregnancy is much more common. So prompt treatment, if you have chlamydia or gonorrhea while it's still in the cervix, is of paramount importance so that you can avoid that. The really scary thing that we're seeing now, though, is that we're seeing emerging strains of gonorrhea that are resistant to our last treatment regimen now available in the United States. And especially in Asia, there are some strains of gonorrhea that are resistant to everything. So we talk about our military personnel deployed overseas, if they aren't educated about this and they bring it back to the United States, that's how we're going to see an increase in spread of those more. Same for any other group of people that's overseas and then come back. So you have to be smart about your choices. Syphilis, in 2016, we saw that the rise from 2015 to 2017 was primarily in males. About 89% of the cases were in the male population. And when you get syphilis, it can increase your risk for getting HIV. And like I said, it can cross the placenta and affect a baby as well. So what are our treatments available? Well, the good news for the bacterial ones is that they are curable and we can treat them with antibiotics, assuming you don't have a resistant strain. Same thing with the parasite Trichomonas, though we are starting to see emerging strains that are resistant, and we only have one classification of medications that will treat Trichomonas, so that's a little scary. Viruses are the sneaky ones. There's basically no cure for most of them, but we can manage the symptoms. And in some cases, you can be given medications that stimulate your immune system to fight off or eradicate the virus, which is what Aldera does for the HPV virus. When you have actual warts, you can apply this and it increases the local immune response, and that helps eradicate the DNA out of the cells. We thought that you couldn't get rid of HPV, but we are seeing that in some people they can clear the virus, including the high-risk strains. So we now have 2 vaccines that can actually prevent cancers. One is the HPV vaccine. Gardasil initially came out about 13 to 14 years ago and covered 4 strains. We now have a second generation Gardasil, which covers for 9. The 2 that most commonly cause the actual wart, and then 7 other of the high-risk strains that are associated with the development of cervical cancer. And I have to say, since we had Gardasil come on the market, the number of young women and women of all ages actually that present with actual warts has significantly declined. I used to see 3 to 4 women a month with warts that needed to be treated. I'm now seeing it maybe 4 to 5 times out of the year. So that's phenomenal. And also the degree of abnormalities on pap smears that we're now seeing are not nearly as high grade as they had once been because of the HPV vaccine that's now available. And a lot of people don't realize this, but in 2011 it was recommended that all men up to age 21 get the HPV vaccine as well. So if you haven't gotten it and you're under the age of 26 for women, under the age of 21 for men, I would highly encourage you to go and get the Gardasil vaccine. The other vaccine that can help prevent cancer is hepatitis B vaccine, and that is in the state of Texas given to babies at the time of birth. It's usually a 3-shot series. Sometimes if you go into certain fields, like a healthcare field, you'll be tested to make sure you still have good immune levels, and if not, you may need a booster. So that kind of covers the treatment. So what you don't know is when you go in to get treated, you're not sure what exactly you're being treated for. Are you being treated just for the bacterial ones or tested for the bacterial ones? Or are you also being tested for the ones that are more blood-borne, the ones that you mount an immune response to? And it's actually the immune response that we are testing for to see if you've been exposed. So chlamydia, gonorrhea, those are usually a DNA test taken from the cervix, sometimes from the urethral opening of the penis as well. Same thing with chancroid, which is not commonly tested for, but syphilis is usually a blood test. And then if the first test comes back positive, you are going to need to have a more sensitive testing done. HIV, hepatitis B and C, those are all antibody tests that we look for to see if you've been exposed to it. As far as HPV, there is no actual blood test. A lot of the time, the way we pick up that someone has HPV is they have actual warts or they have an abnormal pap smear come back. So the reportable ones are chlamydia, gonorrhea, syphilis, chancroid, HIV. I'm not sure about hepatitis B and C, but if your test comes back positive for any of those, your healthcare provider is required and the lab is required to report that to the public health department so that the CDC can track incidence levels. And sometimes you may get a call asking you if you need help contacting your partners, people that you either got it from or may have exposed them to while you had the infection. So what aren't reported? HPV, herpes, and trichomonas are 3 of the ones that are not reported. So when they tell us what the incidence is, it may be actually underreported. There may actually be more cases because it relies a lot on self-reporting. So HPV, there's about 42% prevalence, so that means about 42% of the population at any one time has the presence of one of the HPV DNA viruses. Herpes, they quoted as high as 87 to 90%. And the reason why herpes is a little sneaky is that it can be totally asymptomatic. You can actually transmit virus to somebody else with having no symptoms. About 20% of the time they think that herpes got transmitted from someone who had no symptoms whatsoever. There's no way to prevent the spread or the shed of virus. So being honest with partners is paramount if you do carry the virus. And with trichomonas, it's about a 3% prevalence in the total population. So it's not real high, but it can be pretty hard to get rid of if you do get it, and especially if you have one of the resistant strains. As far as prevention and then limiting consequences of STDs, the ultimate way to prevent them is not to have sex, or at least don't have casual sex. Now, for the vast majority of people, that's probably not going to work. The next advice I can give you is you need to know your partner, and you're not going to get to know your partner by knowing them for a few hours or a few days, a few weeks. Sometimes it takes months, and it also depends on how good a judge of character you are. It takes a while for you to maybe be able to get the full picture of what a person is like. Are they honest in other areas? You have to always remember, if someone's major interest is having sex, they're going to be pretty reluctant to tell you, hey, I have herpes, but have sex with me anyway. Because they're probably afraid the answer is going to be no. So bottom line is get to know your partner. And then I've seen this so many times in the 30 years that I've been in private practice. When you get out of a relationship and before you get into another one, get tested. Or every encounter, get tested afterwards so that you know whether a parting gift was left behind. Because you certainly wouldn't want to bring that into your next relationship and then have to have the awkward experience of having to tell your current partners or partner, oh, hey, by the way, I have this and you need to go get tested or treated. Using condoms and spermicides can help reduce the spread and give you some protection, but it's definitely not 100%. I've seen people either with a condom break or the condom slipped off, and the very real thing of who's putting the condom on. If you get any of the penile secretions on your hand and you're putting the condom on yourself and it's on the outside of the condom, then you can have bacteria, viruses, and or sperm for that matter on the outside of the condom, and it just takes one sperm to get pregnant and sometimes just one of the bacteria to get the infection. So that's kind of a brief overview of sexually transmitted diseases. If you have any questions, please put them on our comment page and we'll try and get them answered as factually as possible for you. Thanks for joining us.